The liver, anatomy, physiology, and related disorders. Welcome to our comprehensive guide on the liver. Today, we'll delve into the liver's anatomy, physiology, examine lipid function lab results, and discuss common liver disorders along with their treatments. Let's get started. Gross anatomy. The liver is a roughly triangular organ located in the right upper quadrant of the abdomen, right below the diaphragm and above the stomach. It's one of the largest organs in the body, typically weighing about 1.2 to 1.5 kilograms in an adult. The liver has two main lobes, the larger right lobe and the smaller left lobe, which are separated by the falciform ligament. Each lobe is further divided into smaller functional units known as lobules. Microscopic anatomy. The lobules are the functional units of the liver. Each lobule is a hexagonal structure consisting of hepatocytes, liver cells, radiating outwards from a central vein. The corners of the hexagon are formed by portal triads, which consist of a hepatic arteriole, a portal venule, and a bile duct. Blood flows from the portal triads towards the central vein, where it then drains into the hepatic vein. Hepatocytes are the primary cell type in the liver, comprising about 80% of the liver's volume. These cells perform most of the liver's functions, including producing bile, detoxifying harmful substances, and storing and releasing glucose. Vascular supply. The liver has a dual blood supply from the hepatic artery and the portal vein. The hepatic artery supplies oxygenated blood from the heart, while the portal vein brings nutrient-rich, but deoxygenated blood from the gastrointestinal tract and spleen. These two blood supplies mix in the liver sinusoids, tiny channels where the blood comes into close contact with the hepatocytes for processing. Biliary system. The biliary system in the liver involves a series of ducts that transport bile, a fluid produced by hepatocytes that aids in digestion. The bile ducts from each lobule merge to form larger hepatic ducts. The right and left hepatic ducts then merge to form the common hepatic duct, which joins with the cystic duct from the gallbladder to form the common bile duct, transporting bile to the small intestine. The liver, our body's largest internal organ, performs over 500 vital functions, such as metabolizing nutrients, filtering toxins, and producing key proteins and cholesterol. The liver cells, known as hepatocytes, perform these functions. They metabolize fats and carbohydrates, produce proteins for blood clotting, and break down toxins for elimination from the body. A lipid panel, or lipid profile, is a blood test that measures total cholesterol, low-density lipoprotein, LDL, high-density lipoprotein, HDL, and triglycerides. High LDL levels and low HDL levels may indicate a risk for heart disease, while high triglycerides can signal metabolic syndromes, including liver disease. Fatty liver disease is a condition where too much fat builds up in liver cells, often due to excessive alcohol consumption or obesity. It usually causes no symptoms but can lead to inflammation or liver scarring. Cirrhosis is a late stage of liver fibrosis caused by various liver diseases. It can lead to liver failure and is often identified by signs like jaundice, bruising or bleeding easily, and fluid accumulation in the abdomen. Hepatitis, inflammation of the liver, is often caused by a viral infection. Symptoms can include fatigue, nausea, and jaundice. There are several types of hepatitis, labeled A, B, C, D, and E. Hepatitis A causes. Hepatitis A is primarily spread when an uninfected and not vaccinated person ingests food or water contaminated with the feces of an infected person. This can occur in areas with poor sanitation or through ingestion of contaminated food or water. Abnormal lab results. Elevations in liver enzymes, AST and ALT, and bilirubin levels are typical. Hepatitis A antibodies, IgM, indicating acute infection, and IgG, indicating past infection, can be detected. Treatment. There is no specific treatment for hepatitis A. Management is supportive and usually involves rest, proper nutrition, fluid intake, and avoiding alcohol. The disease typically resolves on its own within a few months. Hepatitis B causes. Hepatitis B is transmitted through contact with the blood, semen, vaginal secretions, or other body fluids of an infected person. This can occur through sharing needles, having unprotected sex, from mother to baby at birth, or through non-sterile medical or dental procedures. Abnormal lab results. Similar to hepatitis A, liver enzymes and bilirubin can be elevated. Specific markers like hepatitis B surface antigen, HBsAg, antibodies to HBsAg, and hepatitis B core antigen, HBcAg, are used to diagnose and monitor the disease. Treatment. Acute hepatitis B infections do not usually require treatment. Chronic infections may be treated with antiviral medications such as entecavir or tenofovir. Hepatitis C causes. Hepatitis C is mainly spread through blood-to-blood contact. This most often occurs through sharing drug-injecting equipment, unsterile tattooing or piercing procedures, or non-sterile medical procedures. It can also be passed on through sexual contact, although this is less common. Abnormal lab results. Hepatitis C is detected by anti-HCV antibodies in the blood. Liver enzymes are usually elevated, and RNA-PCR tests can determine the level of viral replication. Treatment. Direct-acting antiviral drugs, DAAs, are the mainstay of treatment, with combinations like sofosbuvir, ledipasvir or glecaprevir, pibrentasvir used depending on the genotype of the virus. Hepatitis D causes. Hepatitis D only occurs in those who are infected with the hepatitis B virus, as it requires the hepatitis B surface antigen, HBsAg, to exist. It is transmitted the same way as hepatitis B. Abnormal lab results. Along with elevated liver enzymes, specific markers such as hepatitis D virus RNA or anti-HDV antibodies are detectable. Treatment. Hepatitis D is difficult to treat. The drug peginterferon alpha is sometimes used. It is also important to prevent and manage co-infection with hepatitis B. Hepatitis E causes. Hepatitis E is usually transmitted through the consumption of contaminated water or food. It's common in areas with poor sanitation. Less commonly, it can be transmitted through blood transfusions or from a pregnant woman to her baby. Abnormal lab results. Liver enzymes and bilirubin may be elevated. Specific IgM and IgG antibodies to HEV are used to diagnose the disease. Treatment. Similar to hepatitis A, there's no specific treatment for hepatitis E. It is usually self-limiting, but can become chronic in immunosuppressed individuals. In severe cases, hospitalization may be required for supportive care. Treatment of liver disorders may involve medications, such as antivirals for hepatitis or drugs to slow liver cell damage in fatty liver disease. Lifestyle changes, like reducing alcohol intake, maintaining a healthy weight, and eating a balanced diet, are often beneficial. In advanced cases, a liver transplant may be necessary. That concludes our exploration of the liver, our body's metabolic powerhouse. Thanks for joining us today. Are you a medical or nursing student looking to deepen your knowledge? Discover #MediNurse on our YouTube channel, MD Talk Health and Fitness. Get access to our comprehensive MediNurse Essentials, Mastering Medicine playlist that simplifies complex medical topics. Join us and be part of our growing community as we learn, grow, and excel in our medical journey together. Remember, always consult your healthcare professional for any concerns related to your liver health. Fade out. The screen fades to black with the video title and production credits. The Liver, Anatomy, Physiology, and Related Disorders. An educational presentation by your MD. Online, LLC.